The Gamma Knife is a machine made by a company called Elekta that is the gold standard for treatment of tumors in the brain. The thing that makes the Gamma Knife particularly special is the ability to put very, very fine precision treatments on very difficult to treat tumors in very eloquent areas in the brain. And if you are in need of any intracranial treatment, it is the gold standard for radiation oncology treatments inside the brain. So when patients first come to see us, they're often kind of confused as to what exactly radiosurgery is. It has the word surgery in it, so they think there's got to be some kind of knife involved, and the machine is called a gamma knife, so they're worried that they're going to be cut open in some way. So they're kind of surprised when they find out that it really just requires them to hold still with a mask on or a frame on, and then we deliver the treatment and they walk out of here. And they're really kind of surprised that we're able to remove these tumors and treat these tumors without that much toxicity. That is a pleasant surprise for many patients when they come through here and they realize that, wow, this really isn't as daunting or scary as it sounds. Knowing they're not going to be radioactive and they can be around their children, for example. That's a huge relief for many patients. In radiation oncology, the side effects that you may experience are totally related to where we treat you. So obviously when we're treating inside the brain, that can be an eloquent part of the body to be radiating. Frequently, patients don't have side effects much at all to speak of because of the eloquence of the treatment. So the most common side effect we tend to see when we treat people with brain metastasis, or especially with multiple brain metastasis, is we're treating, say, 5 or 6 or 7 areas, is you can have some swelling in the brain. And that typically, the patients will present with a headache. Say, hey, I'm having a headache, I'm having some nausea, I don't feel well. Well, we know we just treated multiple tumors in the brain, so frequently you can get some imaging and give them some steroids, and that'll decrease that inflammation, and they do fine. During the Gamma Knife procedure, patients can expect to come in and see us, and we can discuss what the treatment is going to entail. Depending on what we are treating, the protocols vary. So some patients are treated in a single treatment, and if they're coming from far away, and we do treat a lot of patients who travel to come here because we are so specialized, and so they'll come in the morning. We'll actually get an MRI the day of the treatment. We'll do the MRI in the morning, we'll plan the treatment, the patient will come in, be treated, and then they'll go home the same day. No significant anesthesia or hospital stay is required. Just a little light sedation for some patients that are getting a single treatment. Other patients are coming in, and also coming from far away as well, and they need multiple treatments, and maybe they don't need a frame immobilization, which can be a little bit more involved. They just get a mask treatment. We make a thermoplastic mask, which helps hold the patient in place on the machine, do the imaging that's necessary, do the plan, deliver the plan, and then they go home with their family member, and they may come back once a week or several times a week for these treatments. But we tailor it, and we're able to treat multiple tumors. For example, I may have a patient with 7 or 8 metastases. Well, that, in the old days would have been a death sentence. Now we can see them, simulate them, plan them, treat them, and maybe in the course of 5 treatments, target all of the lesions in the brain, and then the patient can go on to their systemic therapy or whatever additional treatment they need.
So we've seen just an evolution of radiosurgery across the board, both with the Gamma Knife on brain problems, as well as the Varian Edge. I think what's been recognized is that this is the future of radiotherapy, that conventional radiotherapy has a place, but its place is becoming narrower and narrower. And as more and more people get expertise in radiosurgery, they're realizing that this is more or less the more effective and safer way to go. And so you can do more for people and cause less harm. And in the end, that's what you're trying to do with medicine. You're trying to help them, not hurt them.